Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Rockville, Maryland, discussing the latest advances in dental technology and how they can help restore your dental health and improve your smile with two of this area's top dentists, Dr. Cheryl Callahan and Dr. Joyce Thomas. Dr. Callahan earned her dental degree from the University of Michigan. Dr. Thomas earned her dental degree from the University of Pennsylvania. They are both members of the American Dental Association and the Maryland State Dental Association, as well as the Academy of General Dentistry, among others. Welcome, Dr. Callahan and Dr. Thomas.
Thank you.
What are some of the more frequent dental problems that you see here at your practice from patients that are coming to you all?
Caries is the clinical term for cavities. It's one of the most common things that we treat.
And what age would you say the cavities really start taking hold within our mouth and our teeth? I mean, I'm sure we're talking about generally more kids than adults, but I'm sure there's some adults that are also coming in with cavities.
They can start as early as when a person has their first tooth. There are children who have rampant decay throughout their mouth, and adults can have the same problem as well. But even for an adult who has had a relatively healthy mouth, as we are all living longer, possibly on more medications, possibly have more root surface exposure, even our adult patients can end up with lots of decay depending on the conditions of their mouth. The other thing to realize about decay is that it is cyclical, and so what that means is that it's not always active. They may go through periods of quiet decay, everything's very healthy, and then due to a change in their health, due to a change in their stress levels, their diet, their hygiene, it can recur again. And so that's one of the reasons for having regular checkups and for establishing a relationship with a dentist, that they can be able to be aware of the changes as they're occurring and say, hey, what's going on, what's different now? And also with regards to some of the risk factors, it's not only the sugar in the diet, but a diet high in sugar, and also with drinks, acidity. So the combination of acid in sports drinks and sodas combined with the sugar really does damage to people's teeth, weakens the enamel, and then can make the potential for decay that much higher because the enamel is weakened.
How would you say cavities would affect our overall health?
It can affect your ability to function depending on how painful it is. There are children who can't attend school because of toothaches, adults who can't function at work. Decay can, once a tooth becomes infected, the infection can spread and become life-threatening. And so that's something that needs to be addressed, obviously, before.
What would you say, Dr. Thomas, is the main cause of cavities?
One of the main causes of decay that we see in the practice is a diet high in sugar. And sugar not just in the foods that they eat, such as candy bars or sticky foods, but sports drinks. Many of our patients are athletes who are drinking sports drinks throughout the day, sodas throughout the day, coffee and tea with sugar, and all of that constantly bathing the teeth in sugar can cause a high rate of decay.
And what would you say, Dr. Thomas, would be effective treatment options to take care of the cavities?
Well, we'd ideally like to see the patients before it gets to the point that the teeth need to be prepared and restored. And that's where the remineralization therapy that we talked about earlier would come in. We'd be able to address with them how they can take care of it at home. But if it's at the point that the decay is causing them pain or the teeth are discolored or broken, they can be restored with white fillings, veneers, crowns, depending on how much tooth structure has been lost due to the decay.
And lastly, what would you say to all the folks watching out there? What preventive measures can we take to avoid these problems in the first place?
The preventive measures that they can take, first and foremost, the easiest is to minimize the sugar in their diet. Having regular checkups. For children, when the permanent molars and premolars erupt or come into the mouth, having sealants placed on them. They're painless, they're very easy to apply, there's no tooth preparation involved, and it's able to cover the surfaces of the teeth on the chewing surfaces that toothbrush bristles can't fit down into, and where children most commonly develop decay. They can also improve their hygiene and use a toothpaste and mouthwash that contain fluoride, because it's an important component of being able to remineralize tooth structure.
So that's still very important to utilize, is the fluoride that we've heard of.
Yes, very much so.
I wanted to segue over to you, Dr. Callahan, and ask you if you can please tell us about periodontal disease.
Sure. Periodontal disease is unfortunately, fairly common occurrence in a lot of adults. It can start even as a teenager with juvenile periodontal disease. But what periodontal disease is loss of bone around the tooth structure that makes the tooth structure mobile. So it's a bacterial infection of the gum and the bone that disintegrates the structures that hold the tooth in place. So periodontal disease, oftentimes we'll see patients and diagnose periodontal disease, and it would be the first time that maybe a patient has been told that they have periodontal disease, subsequent to find out that they've newly been diagnosed as a diabetic. Oftentimes periodontal disease will show in the mouth, but it's correlating to a medical problem. And
so you're talking about something that it may, like you said, show in the mouth, but it could be a far greater problem with our health that it's basically a symptom of.
Exactly, and that's not uncommon for us to see a patient and diagnose periodontal disease. And if it's new to them and they've never been told, we'll ask them, have you been to your physician?
Sure.
Any history of diabetes in your family? The other is that there's a correlation with cardiac disease and periodontal disease. So having a healthy mouth is very important, as periodontal disease can also be a contributing factor in cardiac disease.
So periodontal disease certainly can in a significant way affect our overall health.
Yes, because if you do have periodontal disease, it also affects your chewing ability, and that will cause gastrointestinal problems and unable to eat, as well as pain and discomfort. And periodontal disease is oftentimes goes undiagnosed from the patient's point of view because it doesn't often hurt. When they'll come in and say, well, nothing's hurting me, but by the time that we see them, they have fairly advanced periodontal disease. So it can be asymptomatic until it gets to the later stages.
Well, I appreciate you letting us know that. That's certainly very good for us to know and what to watch for. Now, how can periodontal disease be detected, Dr. Callahan?
It could be detected in a dental office by having a periodontal exam, by doing probing depths around each tooth to diagnose the correlation between the healthy tight tissue versus loose tissue or loss of bone. Oftentimes at home, people would not know they had it at all.
No, you wouldn't. You're absolutely right. And are there any common symptoms, though, that we should watch for that could let us know that, hey, I may have periodontal disease?
Bleeding to brushing.
Oh.
Sometimes an odor in your mouth
Okay.
can be indicative of periodontal disease. But bleeding would probably be the first symptom that somebody would notice at home. What they would notice at home, in addition to bleeding, may be looseness of the teeth, that maybe the teeth are moving.
Oh.
Can also be an indication of periodontal disease in somebody that had no idea that they had it.
And what treatment options would you recommend, Dr. Callahan, that can take care of this problem?
Treatment options can start by just changing home care, by just changing the way people clean their mouths. And that would be the first thing that we would try. Oftentimes antibacterial rinses can be added, chlorhexidine or even Listerine, and going all the way up to doing a deeper cleaning. And at the far end of that treatment would be periodontal surgery and treatment with a periodontist. So hopefully we can diagnose early enough that surgery would not have to be done.
Yes, last resort, right?
Exactly.
Now, lastly, regarding periodontal disease, I wanted to ask you any preventive measures that we can take, that we should be aware of, that can help us eliminate any chance of getting to that point where we have periodontal disease?
Yes. The Brushing, flossing, and good home care is the basic secret to success.
Yes.
And going to the dentist on a regular basis so that if there are any early changes, they can be diagnosed early to prevent any further deterioration of the mouth.
Now, when you say regularly, just for the viewers out there who may not know, do you recommend going to a dentist every 6 months for a cleaning, a checkup, or are you looking at once a year?
Yes, 6 months would be ideal for a healthy mouth.
Okay.
Some people with periodontal disease need to come every 3 months or every 4 months because you want to cleanse that bacteria out
Yes.
as soon as it starts to collect in the teeth. So 6 months in a lot of people is too long.
Okay. No. Dr. Callahan, I wanted to stay with you regarding another area that we wanted to touch on briefly, and that is something called clenching and bruxing. And I wanted to have you tell us what that is.
What that is clenching your teeth. When you sleep, some people do it during the day. Bruxing is grinding your teeth. So a side-to-side movement or a back-and-forth movement, all that stress on the teeth can deteriorate the teeth, the gums, and the bone structure, as well as the temporomandibular joint. So
TMJ could result.
TMJ, exactly.
Yes.
So eventually, with all that force being generated, something gives, something breaks down. Maybe you'll break a piece of a tooth off. Maybe a tooth will become sore because it's constantly getting added stress.
Yes.
Some people get muscle discomfort in their joint, and some people actually the joint deteriorates. So it's a serious problem that people oftentimes don't even realize that they're doing it.
Now, is there a typical age where these the clenching and the bruxing starts taking place? An age range that you see quite a bit of out
No,
there?
we'll see it in as early as young children just getting their teeth. Parents will say, I can just hear them in the hallway. You know, the noise is awful. You know,
Oh my
or
gosh.
we went on vacation
Or
and
when
my
we're
child is
sleeping,
grinding
right?
their teeth.
Yep, all that's going on.
Right, but it goes all the way up through adulthood, but it can start very early.
Now, how can clenching and bruxing be detected if we're doing it in our sleep or we're not aware of it? How can something like this be detected by us?
The patient will oftentimes present with headaches and not know why they're having headaches. And sometimes that headache can be originated from grinding or clenching their teeth. Or maybe just soreness in the face. When they come to the dentist, often what we diagnosed and what we see oftentimes is and we'll introduce that topic to the patient, is a lot of wear on their teeth. So their teeth have either flattened or gotten much smaller. And patients will say, well, I don't think I grind my teeth, but at that first visit, if we introduce it, and then they'll come back maybe 6 months later and say, you know what, I really do think maybe I do grind my teeth.
Yes, that's the way to find out.
That's
You
right.
need to come to a dentist.
Yes.
And you'll be able to pick that right up, of
Yes.
course. Now, what treatment options would you say, Dr. Callahan, that you could recommend to the viewers watching regarding this particular problem?
So treatment options can be several different options. One, sometimes orthodontics is needed.
Okay.
Maybe moving the teeth to a different position that will have the patient stop grinding or clenching. Sometimes it's wearing a night guard or some type of an appliance that acts as a shock absorber. So it doesn't stop you from grinding, but it helps protect the teeth and the structures of the mouth and the face. And the third is sometimes just doing what's called an equilibration or reshaping some teeth. Polishing them or reshaping them so that they're not hitting as heavy as other teeth.
Okay.
But that needs to be done very carefully and after taking a close look at the overall occlusion of the patient. Both Dr. Thomas and I have spent a lot of time at the Pankey Institute studying occlusion and the effects of occlusion and how it affects the not just the restorative work that we do, but just the overall health of the patient.
And that's a very distinguished institute,
Yes.
indeed. So now, as far as preventive measures for clenching and bruxing, anything that you could help us out with that we should be aware of, that we can do on our part to try to at least minimize the chance of us falling into the clenching and the bruxing area?
Well, sometimes just being aware that you're doing it. So a daytime habit, a lot of patients can teach themselves to stop. And there's a lot of people driving. Creates a lot of stress with people, and they may not grind, but they may clench.
Yes.
Sitting in front of the computer,
We're literally out of time. We've only got a few moments left, but I have to ask you both before I let you go, Dr. Callahan, and you, Dr. Thomas, as well. You and your practice here have established a reputation of dental excellence throughout this region. And I wanted to ask you, what would you say is the primary reason and the cause that separates you and your practice apart from many of the others?
Well, I think one of them, and the main reason that I think, is that we treat our patients like we would like to be treated ourselves. We care for them. We don't just look at their mouths. We look at their whole being, their how it affects their medical history, or how socially what's going on in their lives. So treating each person as a person and as an individual is very important to me in the practice.
And Susan and Jacqueline, the two patients we had on today, those were literally the exact words they said. So that says a lot about you and your practice, indeed, with both of them just being a few of the many patients that you have, and so many of them look at you all like a family.
Yes.
Because you treat them like family.
Exactly, yes.
Patients tell us all the time that we wish all of our doctors' offices were like this. We love coming here because you all remember us and you remember things about us. And it's just very gratifying to know that our effort to make them feel welcome is appreciated. And they're very appreciative of what we do for them and appreciative of our staff. We have an amazing staff that really help us to do our job well. And the patients all recognize that from the moment they walk in, through their treatment in the back to even, follow-up appointments, they feel as though they are taken care of, that we are really attending to what they need.
Not to mention the state-of-the-art technology that you all utilize here in your dental practice.
Yes, education is very important to us, so all of us on the staff take pride in pursuing education on a regular basis.
Now, before I let you go, I know we're out of time now, but Birdie told me before I started this interview today that you all do something which very few practices that I'm aware of do, and that is you have extended hours to see your patients that goes not only into the evenings, but weekends as well if needed to accommodate your patients. Is that correct?
It is. We start the practice at 7 in the morning and go until 6 at night, and Dr. Thomas and I alternate and split the day so that the office is covered, as well as working Saturdays.
That is wonderful. That way you can obviously accommodate the varying schedules that patients have and when they can see a dentist, and by extending your hours right into Saturdays, that really helps. And on that note, I'd really like to thank you both. It was a pleasure interviewing you, Dr. Callahan, and you as well, Dr. Thomas. Very informative, very helpful, covered a lot, and again, I want to thank you both for being our guest today.
Thank you.
It's our pleasure.
Thank you.